Well, at least 1 in 3 people in Nairobi has been infected with COVID-19 between March and November last year. This is one of the key findings of a COVID-19 antibody survey conducted here in Nairobi. The study also shows that half of the households in Nairobi had at least one person who had been infected. Those in the age group between 20 to 49 years were more likely to have been infected by the virus compared to children below the age of 10. Helen Aura reports.
Nairobi County has recorded the highest caseload of COVID-19, and a third of all reported COVID-19 deaths in the country have been recorded in the capital. The COVID-19 antibody survey therefore recommends that COVID-19 mitigation measures should continue because many people remain at risk. The study, conducted through random selection within the county, also emphasizes the need for an antibody study to determine the level of transmission in the country.
Antibodies are an indicator of prior infection. When you get a COVID and you have the infection and the infection is over, you get healed or cured, what the body remains with are antibodies. So that means that in Nairobi County, since the beginning of the outbreak in March to November, 35% of the population, which translates to about 1.5 million people, have gotten COVID infection.
The research mainly targeted Nairobi County due to its increasing caseload, now standing at 40%, followed by Mombasa.
Some have said at 6 months they go down, but then this disease has been there for only 1 year. We can only allow for time, and as we keep monitoring.
According to the survey, at least 1 in 3 persons in Nairobi County has been infected by COVID-19 in the 8 months since the first case was reported on March 20th. Those aged between 20 to 49 years of age were more likely to have been infected by the virus. Children below 10 years and people over 60 years had the lowest infection levels. Due to overcrowding, sub-counties such as Embakasi West, Mathare, Ruaraka and Kibra recorded the highest infection rates. Half of the households in Nairobi had at least one person who had been infected. 3 in every 10,000 COVID-19 infected individuals succumbed to the virus, indicating a lower mortality rate than other developed countries.
The children were largely at home during most of last year, and also the elderly people don't move around, but the age bracket 20 and 59 are the ones who are mostly economically active and they were moving around. And it does seem that most of infections did occur while we are doing our usual economic